We got one walking up here in front, Owen. We got another one up in front, Peter. And everybody else, some of them have left, some of them are still here. And guys, if we could, including those entrepreneurs out there, if we could, let's give a quick round of applause to all of our mentors for the time they've dedicated. In addition to our mentors, not only do we have the entrepreneurs that we work with and the companies, but we also have entrepreneurs in residence, also known as EIRs or hackers in residence, so the HIRs. So much cooler of a name than entrepreneur in residence. I'm a hacker. We have 4 entrepreneur in residence, actually 5 now, here in this building. One has traveled all the way from Sweden, who is working on an amazing product in the big data space, full enterprise solution. We have a few that are here from their college classes to work at our place to learn about entrepreneurship and to help design and build a company. We also have a few others who are second-time entrepreneurs that are here hanging out and to take advantage of this energy and this community that's been built around wearables and IoT. So excited to have those here, excited to have our mentors in the building and appreciate all the work they've done. Now, let's get back to the presentation. So I want to introduce Noor of Remedy. She is an amazing young woman who is brighter well beyond her years, including mine, and her sister Gina, founders of Remedy.
The third leading cause of death in the United States. You can hear me? Okay. The third leading cause of death in the United States isn't what you think it is. It isn't breast cancer, it isn't AIDS, it isn't strokes. It's a process that we created and that we can stop. Medical errors are the third leading cause of death in the United States. Medical errors claim more lives than breast cancer, AIDS, and strokes combined. My name is Noor, Siddiqui, and I founded Remedy because doctors need better tools to treat patients. Today, I'm thrilled to share Beam by Remedy with you. Beam gives the right specialist the ability to see the patient through the eyes of the provider on scene. No more ambiguity, no more delays to diagnosis. Let me introduce you now to 2 doctors who use Beam to deliver higher quality care. Dr. Weaver just started practicing medicine. He's seeing a lot of situations for the very first time and needs guidance on tougher cases while he gains experience. Dr. Siddiqui, my co-founder, has been a general surgeon for 15 years. She has seen thousands of cases and has an intuition for what to do just by laying eyes on the patient. Beam stops doctors from telling each other what's wrong and instead shows them what's wrong. Beam supports real-time synchronous consults between any clinician wearing Google Glass and any expert with a tablet or laptop. So what does Beam do for Dr. Weaver? With Beam, Dr. Weaver can now capture pictures and videos of key clinical moments seamlessly through Google Glass. Just a voice command or click, and the media is assigned a case number and synced to Dr. Siddiqui's screen. Abscesses and wounds that were once difficult to describe can now be communicated with objective accuracy. With Beam, Dr. Weaver remains hands-free and patient-centered. He can capture media without interrupting his clinical workflow. Most importantly, Dr. Weaver can deliver more care. With Beam, Dr. Weaver gets the guidance he needs from Dr. Siddiqui and can treat his patient right away. He needs to run less tests and write less referrals. And what does Beam do for Dr. Siddiqui? With Beam, Dr. Siddiqui knows exactly what is going on from wherever she is. She can see how serious the situation is and judge whether she needs to go in to the hospital immediately to perform interventional surgery or whether the situation can wait. With Beam, Dr. Siddiqui feels more confident delivering care remotely. She can see her patients are being cared for from wherever she is. Finally, Dr. Siddiqui is now more connected with her clinical team, with her nurses, with her residents, and with her attendings. She's more accessible to them. She can serve more patients by giving more precise guidance. Beam is already in clinicians' hands at Harvard and the University of Pennsylvania. Our partners are the most well-respected doctors in the country who have a track record of pioneering new technologies at their institutions. Our partners understand that new technology isn't adopted if it's just marginally better. It needs to be better by an order of magnitude. They have guided us into scenarios where we can make the biggest difference. We're bringing Beam to nurses, going on home visits, who are caring for some of the most complex chronic disease patients in our entire healthcare system. We're bringing Beam to the ICU so that grueling 2-hour sign-outs can happen in a fraction of the time. This is the new standard of care. Beam is keeping patients safer and getting them diagnosed sooner. Now, patients and doctors can literally see what they've been missing out on all this time. Here, you can see a video from the perspective of the person wearing Google Glass. So you can see a first responder who has taken a picture on scene of a disaster situation. This is an asynchronous picture that they can sync to a remote expert. So this is also would be a synchronous consult, so a first responder can get guidance in real time for how to repair something like a broken leg. And this is the interface that the expert would see of the media taken by the first responder on scene. Any questions? Thank you.
All right, guys, so any quick questions for Gina and Noor up here?
How do you plan to go to market?
So right now we're at Harvard and the University of Pennsylvania, and we're going to be publishing a paper on the results of these trials, and we plan on focusing on very specific use cases where we're making the biggest difference, where we have the greatest outcomes. So those specific use cases right now are in surgery and they are in nursing. The value proposition for nursing is obviously that a nurse going on a home visit can prevent unnecessary readmission, for example, which costs on the order of $40K per admission avoided. So those are the types of deltas that we're trying to establish.
What's the size of market?
Sorry.
What's the total addressable market?
I mean, it depends on which
Depends
use
on
case
what
you're
use
talking
we
about.
pursue. So, for example, for nursing, there's over 98,000 nursing homes in the country. The elderly population is a growing population. There's over 20 million elderly people. The very complex patients that we're targeting, there's over 2 million in PACE program, which is the first program that we've identified right now.
But we're piloting across a lot of different healthcare use cases. You know, we're putting it on the hands of mid-level providers, we're putting it on doctors, we're putting it on residents in training. And obviously, healthcare in general, if clinicians are picking this up, is 25% of the United States GDP. We've chosen only use cases where the champions, the physicians that we're working with, have already implemented technology like this for the first time in the healthcare system.
Sure. Yeah, so the real answer is the addressable market is too large for the technology as a whole, so we're really trying to narrow and be extremely focused about what use case we focus on first.
What's the barrier to entry? I mean, it sounds like you're leveraging existing technologies in the classes. You're basically delivering real-time video feed, which any kids can do on Facebook, Twitters, and YouTube.
That's a great question.
So I get what you're doing and the value of it, but again,
That's a great question. First, I just want to ask
the
you.
go-to-market strategy and relationships that could help you,
Absolutely.
win.
Absolutely. So the first question I want to ask all of you guys is, why do doctors still use pagers? The barrier to entry in healthcare
Regulation.
is ridiculous regulation and very stringent security requirements. So those relationships with the key hospitals that move the needle for the entire healthcare infrastructure are the only way that innovations come through. And absolutely state-of-the-art encryption, guaranteed secure servers to meet the specifications of these healthcare systems is the only way that they're going to allow it to come through. So the only reason you can't use Google Hangouts, which has a lot of similar functions as this, is that it isn't going to protect patient information adequately.
Yeah, the other big thing, sorry, did you have something to follow up?
No, and have you achieved that, or are you working on it?
Absolutely. We use end-to-end encryption. The data is both encrypted in transit and at rest. And right now, for an extra layer of security, it's stored on the servers only for 8 hours, and then it doesn't persist anymore.
Make sure you say that in your next speech. I think it's helpful.
Absolutely.
Yeah, so the other large barrier to entry is that doctors need a lot of hand-holding when it comes to new technology. So Epic is one of the most well-established electronic health records used at Harvard and Mayo and these types of institutions today. And the reason why they've gotten a stronghold, the reason why they've gotten these multi-million-dollar contracts is
When
because-
Cactus Fusion is available for free.
Yeah, the reason why they've gotten them is because They deploy people on scene to go talk to each of these doctors about how they want the integration of their technology to work. So similarly, the multimedia that we're taking needs to be accessible to the doctor, not only at the point of care when they're resolving this conflict, but also for billing and also, pre-op and post-operatively, they need to be able to access this media and say, how has the patient progressed over time?
If this only happens on Google Glass, can GoPro kind of camera do the same thing?
Two key reasons you have to think about here. One is, what are patients going to accept doctors wearing? What are they going to see as a professional piece of equipment? But two is, what is the best head-mounted display that has the best form factor for the healthcare setting? And Google Glass, we think, is that right now, but it's important to build code that's hardware agnostic, so when the new platforms come along, we can use that too. It's a great question.
One more round of applause, guys.